Once I was sat there waiting to have it done, it was something like, wow, we have actually come so far in such a short space of time. I think I was speaking to lots of colleagues, everyone was having that same kind of moment, just, wow, this is really exciting to be part of.
My first one was given to me by an old co-worker of mine from years back in the ER. I cried for a long time once I made it back to the car. There was a lot of people's names to remember.
My appointment time came, I went downstairs and I saw one of my best friends from work, Mo. I think you met Mo. And so we sort of got vaccinated together and it was very emotional.
I lost patients that I was really, really fond of. And most of those ones who fortunately still with us are getting their vaccines, though not all of them.
Where we are at here in Scotland is where we've got the first data today that's shown there's been a reduction in cases in our kind of care home population. They were the first in Scotland to get the vaccine, so we're really excited about that. And I think we're just really excited to see what the new normal looks like.
It feels, for the moment, it feels like we made it. And I hope I'm not saying that prematurely, because it was so bad last year.
That level of anxiety that we had in the beginning, where we didn't know if we were going to get sick and pass it on to our families, we don't really have that feeling anymore.
I am desperate to stand at a crowded bar and try and get a beer. That's what I really want to do. That's my kind of level of normal I want to get to. I want to go and watch a rugby game with a crowd, and that would be great. So I think the sooner we can get to that, we don't know when, but that's what we're kind of all focusing on here.
The other thing that's happened is just these last few weeks, we started to see the new variants. The UK variant has come to Massachusetts, and the US and Massachusetts in small numbers. And now, more recently, the South African variant has come. And it's giving us concern, but I think most of the experts feel that the vaccinations that we have are going to be reasonably protective even against the new variants.
Maybe there'll be people have a bit more balls and decide to have mandatory vaccines. Mandatory vaccines for healthcare staff, mandatory vaccines for social care staff and carers. Mandatory vaccines for schools would be interesting.
After some back and forth, I was able to get my son on the Friday before level 3.
These two are on the couch snuggling with my cat, and it just lifts your heart to know that you're coming home to a complete home, not a broken family anymore.
There's this kind of culture of calling everyone a healthcare hero, right? Where it's like they're they're here, and like there's images of doctors next to Superman and Batman and Spider-Man, and it's like, we're being raised in this platform of like really these expectations that we're not meant to be living up to.
Most impressive are all the technical staff. So the clerks that register patients, the people that clean the rooms, the security guards, because they're there every day and getting probably the most exposure.
We're no more a hero than my postman or the delivery man or anybody who's out there doing the best they can.
I went out at lunchtime and it was just silent. There was a lot of talk about the health system being at the front. We were the front line in this war that was the COVID pandemic. The reality is our communities became our front line.
I wonder whether the hero narrative and the war narrative makes it all sound like this was all totally inevitable, completely out of our hands.
It's hard to feel like a hero when so many people are dying. You know what I mean?
I finally understand what it means to be a veteran, and people thank them for their service. But are you really thankful?
I want people to learn from this that the institutions that they trusted betrayed them. They're paid to be the ones that saw the Chinese doctors or medical workers in the hazmat suits wheeling the patient, and to look at that and go, ooh.
They sacrificed a lot of lives. Healthcare workers at the bedside were not protected.
No one actually refused to work because of lack of PPE, but that doesn't mean we don't remember.
I want people to work very hard to minimize risk, put things in place that I don't have to be a hero who goes in without a mask, you know, or a cape if you want.
There was this moment of going, wow, did I really sign up for this? And I can't imagine how it feels if you're in Italy or New York, but we did sign up for it.
I considered not coming back, but I'm just like, I love it there, and people there are amazing. It's so great to have people that love you and care about you.
I don't want to be a doctor anymore. I feel like I don't have that much time and I want to do whatever else I want to do. I think it's early days. I'll give it some time. I'll give myself some time. One thing, I have a mortgage, so I still have to work.
Ultimately, what makes you a good doctor is not how intelligent you are. It's not what your grades were. It's not what score you got in the exam. It's how willing are you to show up and roll up your sleeves.
I love my job. And I think now I love it more.
This, I think, is a trial run for something we really can't fight. That's going to be nastier and bigger. And if we continue the way we're going, it's an inevitability.
In my 9 months as a doctor, I've seen so much of my generation in society, just an air of entitlement, of self-righteousness, of I deserve this and that's what I need.
I just can't see that we're going to be flying around the world having holidays by Christmas. And, you know, there's a part of us that wants that life back, and there's a part of me that finds it now slightly repulsive. The thought of level of consumption that we've all partaken in.
I would love to be sure that we're going to change things for good, both in the health system and in the public world, but I'm not really sure if we will be able to do it.
I think we need to really take a step back and look at what it is we're doing with our time on this planet. I don't think we're good stewards of the world. And I think that it is because we kind of have this sense of the indestructibility of the world around us. What this should bring home to everybody is how interconnected we are and how very close to the Middle Ages we still are, even though we think we are so sophisticated now. It didn't take much for the world to break apart. It really didn't.
I wish I could just see my patients in the way that I used to see my patients. I wish that really fervently, but I know that that's just a dream now. We will always have COVID now.
I'm back working in the same hospital I was working in at the start of the pandemic. General ICU is full of unvaccinated patients. Many of them are in their 30s, 40s, young families just like me. It's heartbreaking.
We're tired. We're like emotionally, physically, mentally exhausted. It's just draining. Like, when is this gonna end? Nobody knows.
There are those who want to get back to how it was before, but that's impossible. And then lingering at the back of our minds, there's this sense that, well, yes, the majority of the UK population are vaccinated. But what about all these variants that might come trickling through?
The Delta variant is the big thing now, and that's affecting kids. So most of the kids are going into the ICU, and children are dying. They're dying, and it's very scary.
It's scary how quickly it takes a hold and how quickly it's spreading.
We haven't even acknowledged to ourselves the Delta thing is real yet. Most of the populace are around here is looking around thinking it's over with.
Gavin and I have gone back into our bubble. I started using my N95 again yesterday at work and for when we go out.
Standing in line at the store today, and I was the only one out of about a dozen people wearing a mask.
The Ethiopian Prime Minister said early in the pandemic that if we do not make this a global effort, COVID-19 will come back to haunt us, and I think we are seeing it, and we will continue to see it.